Okay, let me see. Sandy wants to know, I have bad back problems and bad back pain, right? So the question is, first, how effective is back surgery at resolving that pain?
50-50.
Okay. So in other words, what you're asking is, I'm in a rush to get a surgery which is roughly 50-50 effective. Say that out loud to everybody else here and see what happens in the group. Dr. Rutledge, quick, I'm in a big rush to have a surgery that's about 50-50 chance of helping me. Sounds a little funny when we say it that way, right? Let me go back for a second and ask you to do something else first. You have severe back pain, okay? I have operated on 6,000 people, roughly, right? Pick some number in your mind, 10, 20, 100 people of my patients, and find out 50 people of mine who had severe, crippling, devastating back pain before surgery. And ask them what happened to their back pain after their MGB.
Go on.
Well, it's better than 50-50.
That's what I try to tell her, but she keeps saying that on that.
I know, but let's talk about it for a second. So, the research on back surgery, not so good. Yes?
Hello, Dr. Rutledge. Just coming in pretty fast.
Oh, good. Well, welcome.
Thank you.
All right, so the research on back surgery, look it up and confirm this. I haven't looked it up recently, but if you'll send me an email, I'll do some research. But let's suppose we take everybody who shows up in a bone doctor, orthopedic surgeon, neurosurgeon's clinic with back pain. Terrible back pain, pinched nerves, like you say. You look on x-ray, you see the bone pinching on your nerve, right? And then we go back and scientifically study them and look a year later and see how many have gotten 100%, 70%, 50% relief of their back pain.
That's what I'm hoping.
It's not very good.
Oh.
It's really bad. Because there's a lot of controversy. A lot of people think that we over-operate for back pain. That the back surgery doesn't often resolve the back pain. So let's get a number, and I apologize, I don't have that number with me today. But we're going to look into it, you and I, right? Promise, you and I are going to look into it. We're going to find the chances that you're going to get better from surgery on your back.
I've already had back surgery.
How did it do?
It did great when I was younger.
Right, okay. So you had a good result with back surgery in the past. For how long? How long did it last? 10, 20 years? Or?
Yeah, probably 20, 30 years.
20 or 30 years, so that's good. So you could say, but what I would like to know is for somebody who's had previous back surgery, what's the chances the new back surgery will help you? So let's look that up. That's a scientific question. We might be able to find out the answer, okay?
Great, thank you.
Let's suppose that it's 50-50. I'm just going to make that number up for today. But if it's 50-50, should you be in a rush to get it? And let's suppose you talk to 100 of my patients with back pain, and they say 90% say their back pain gets much better after my surgery. What would you think is smart for you?
Not have it.
Not for right away. Give it some time. See what I'm saying?
Yes.
Now, do you expect your back pain to be better on the first day after my surgery?
I had so many other pains going in, and like you say, my knees, I've had knee replacement. I thought I was going to need another knee replacement. The diabetes in my feet was horrible. I mean, all of that is gone. My joints and all that is just my fibromyalgia. This is the only pain I have left.
So you still have back pain today?
Yes.
And prior to surgery, did you take pain medicine for your back pain?
Yes, for years.
Yeah. What kind? Can you tell us how much?
Oh, Vicodin, extra strength.
And how many of those would you take in an average day?
I would take at least 3.
Okay. And maybe as many as maximum would be?
5.
3 to 5 every day.
To try and be mobile.
I gotcha. Right. And how many have you taken this week?
None.
Pardon me?
None.
I can't hear you.
None.
Okay, now, You remember the pain scale that we use between 1 and 10? Pre-op, when you were taking the Vicodin, the 3 to 5 Vicodin a day, how much did your back hurt between 1 and 10 on an average day before surgery? 1 being a paper cut, and 10 being shot with a gun, run over by a bus, dropped off of a building, and set on fire. So the average pain of your back, taking the Percocet, the Vicodin pre-op, what was your pain like before surgery for your back?
Like I say, I had a lot of pain all over.
Right, but in your back, just give me a rough number, 3, 5, 10, 2...
Probably an 8.
An 8. Okay, and this week your back pain has been a what? On average this past week?
A 10.
The back is really hurting this week.
She has a sciatic nerve extension.
Okay. If you're like most of our patients, I would say in the next couple of weeks that's going to get better, even without the Vicodin.
Yes.
And so my advice would be to stay in touch with me about that. But I'd say we have a good chance that just like it may take months to get over your diabetes, that back pain may take a little longer. But I have a belief from my previous patients that we're going to make that much, much better.
Wonderful.
Also, when was the last Vicodin you took? How long ago?
Months ago.
2 months? 3 months?
Probably 2 months.
2 months ago. Okay, what we see in our patients is when they've been on that Vicodin and they have the anesthesia, they get a drug withdrawal effect from the surgery. You've heard about people who get addicted to narcotics and they stop the heroin and they get the shakes and pains and sweats and things like that. We have seen that in the first couple of weeks after the surgery that it kicks off kind of a drug withdrawal response, and so part of your feelings of pain in this week might partly have been a drug withdrawal response, so that back may get better as you get further away from the Vicodin and the surgery.
Oh, great. Thank you.
I hope. And excuse me. My opinion is that the back surgery itself is not that effective.
Yeah.
So I wouldn't be jumping on that when we have this chance that the surgery, the MGB, may make everything better.
That's what I was hoping. That was after I had gone to a pain management place.
Right.
And they had recommended, did I think about this, not the MGB, but the other bypass.
Right.
And I said, yeah, I had researched it, but I didn't want any more surgeries. And I didn't want to stay under too long, and there was a lot of research. And then I started redoing it again and found this and other people that have had it done that I know personally. I have her picture. She taped it up to the bathroom mirror, so every time I go into the bathroom, I see this girl's new picture, and I know what she looked like before, and to see her like that was just, I just can't believe it's
good. Trish, Sandy, are we going to get those two on tape? Are you guys sitting there for a reason, or not interviewing them? Could you take them now and do a video? No, I want them to go and do their video now. Yeah.
We're ready to go.
Yep. Go. Yeah.
Are you talking about Paul and Chris?
No.
All right. Let's go.
Other questions?
Good luck, everyone.
Thank you.
Thank you very much. Good luck.
Other questions?
I wish I'd brought my brother here.
Your brother?